51. A patient diagnosed with a cerebrovascular accident, CVA, is receiving anticoagulant therapy. Which of the following is the most important nursing intervention? A. Monitor for signs of bleeding. B. Assess for signs of infection. C. Monitor heart rate and blood pressure. D. Provide patient education on diet. Answer. A. Monitor for signs of bleeding. Rationale. Anticoagulants increase the risk of bleeding, so it is critical to monitor the patient for any signs of internal or external bleeding. 52. A nurse is caring for a patient with a history of seizures. Which of the following is the priority action during a seizure? A. Keep the airway patent. B. Restrain the patient to prevent injury. C. Administer anticonvulsants immediately. D. Place the patient in a side-lying position. Answer. A. Keep the airway patent. Rationale. Maintaining a patent airway is the priority during a seizure to prevent aspiration and respiratory compromise. 53. A 70-year-old patient with a history of hypertension is admitted with signs of a stroke. Which of the following would be a contraindication for thrombolytic therapy? A. Uncontrolled hypertension. B. Age over 65 years. C. Family history of stroke. D. Hyperlipidemia. Answer. A. Uncontrolled hypertension. Rationale. Uncontrolled hypertension is a contraindication for thrombolytic therapy as it increases the risk of bleeding. 54. A nurse is educating a patient with multiple sclerosis about disease progression. Which of the following symptoms is most commonly associated with this condition? A. Fatigue. B. Seizures. C. Nausea and vomiting. D. Decreased heart rate. Answer. A. Fatigue. Rationale. Fatigue is one of the most common and debilitating symptoms of multiple sclerosis, often affecting daily activities. 55. A patient with a history of epilepsy is prescribed lamotrigine. Which of the following is a serious side effect that requires immediate attention? A. Rash. B. Insomnia. C. Weight loss. D. Dizziness. Answer. A. Rash. Rationale. A serious rash can be a sign of a life-threatening reaction, e.g., Stevens-Johnson syndrome, to lamotrigine and requires immediate medical attention. 56. A patient with a recent diagnosis of Alzheimer's disease presents with memory loss and confusion. Which of the following is a hallmark symptom of Alzheimer's disease? A. Progressive memory loss. B. Uncontrolled muscle spasms. C. Sudden onset of headaches. D. Frequent vomiting. Answer. A. Progressive memory loss. Rationale. Progressive memory loss is a hallmark symptom of Alzheimer's disease, which affects cognitive function over time. 57. A patient with Guillain-Barré syndrome is admitted to the hospital. Which of the following is the most important nursing intervention? A. Monitor respiratory function. B. Assess for skin breakdown. C. Administer for fluids. D. Provide a high-protein diet. Answer. A. Monitor respiratory function. Rationale. Guillain-Barré syndrome can lead to respiratory paralysis, so monitoring respiratory function is the most important intervention. 58. A nurse is caring for a patient with a suspected brain tumor. Which of the following diagnostic tests would provide the most accurate information? A. CT scan. B. MRI of the brain. C. X-ray of the skull. D. Electroencephalogram, EEG. Answer. B. MRI of the brain. Rationale. An MRI provides the most detailed and accurate images of brain tissue, making it the best choice for diagnosing brain tumors. 59. A patient with a spinal cord injury at the C6 level is being taught about self-care. Which of the following is the most appropriate teaching point for this patient? A. You may require assistance with breathing. B. You will have full use of your arms and hands. C. You will have difficulty moving your arms and legs. D. You may need assistance with bladder and bowel management. Answer. D. You may need assistance with bladder and bowel management. Rationale. AC6 level spinal cord injury often affects motor function and sensation below the injury, including bladder and bowel control. 60. A patient diagnosed with a stroke has a left-sided hemiparesis. Which of the following should the nurse focus on during rehabilitation? A. Improving left-sided strength and mobility. B. Encouraging the patient to sleep on the left side. C. Limiting use of the affected side. D. Restricting use of the unaffected side. Answer. A. Improving left-sided strength and mobility. Rationale. Rehabilitation focuses on improving function in the affected side, left side hemiparesis in this case, including strength and mobility. 61. A nurse is caring for a patient with Parkinson's disease. Which of the following medications should the nurse expect to administer to help manage the symptoms? A. Levodopa/carbidopa. B. Phenytoin. C. Diazepam. D. Baclofen. Answer. A. Levodopa/carbidopa. Rationale. Levodopa/carbidopa is commonly prescribed to manage the symptoms of Parkinson's disease, particularly tremors and bradykinesia. 62. A patient with a history of epilepsy asks about triggers for seizures. Which of the following should the nurse explain as a common trigger? A. Stress. B. Increased physical activity. C. Dehydration. D. Eating a large meal. Answer. A. Stress. Rationale. Stress is a common seizure trigger for many individuals with epilepsy, and managing stress can help reduce seizure frequency. 63. A patient is diagnosed with a brain abscess. Which of the following symptoms is most commonly associated with this condition? A. Severe headache and fever. B. Visual disturbances. C. Loss of coordination. D. Facial weakness. Answer. A. Severe headache and fever. Rationale. A brain abscess commonly presents with headache, fever, and focal neurological deficits as it causes inflammation and infection in the brain. 64. A nurse is caring for a patient with a history of stroke. The patient is unable to communicate verbally, but can still understand speech. Which of the following is the most likely condition? A. Aphasia. B. Dysarthria. C. Apraxia. D. Anomia. Answer. A. Aphasia. Rationale. Aphasia is a language disorder that affects speech comprehension or production, but does not affect general understanding. 65. A patient with a recent traumatic brain injury has a Glasgow Coma Scale, GCS, score of 10. What does this score indicate? A. Severe impairment of consciousness. B. Moderate impairment of consciousness. C. Full consciousness. D. Mild impairment of consciousness. Answer. B. Moderate impairment of consciousness. Rationale. A GCS score of 10 indicates moderate impairment of consciousness. Scores of 3 to 8 are considered severe, and 9 to 12 are moderate impairment. 66. A nurse is caring for a patient with a head injury. Which of the following signs is most indicative of increased intracranial pressure, ICP? A. Decreased level of consciousness. B. Increased heart rate. C. Increased blood pressure. D. Hyperventilation. Answer. A. Decreased level of consciousness. Rationale. A decreased level of consciousness is a key indicator of increased ICP due to pressure on the brain. 67. A nurse is caring for a patient with epilepsy. Which of the following should the nurse teach the patient to avoid to reduce the risk of seizures? A. Alcohol consumption. B. Increased exercise. C. High protein diet. D. Regular sleep pattern. Answer. A. Alcohol consumption. Rationale. Alcohol can lower the seizure threshold and increase the risk of seizures in individuals with epilepsy. 68. A patient with a myotrophic lateral sclerosis, ALS, is experiencing difficulty swallowing. Which of the following interventions is most important to prevent aspiration? A. Suction the patient's airway frequently. B. Administer thickened liquids. C. Position the patient with the head elevated. D. Encourage the patient to eat solid foods. Answer. B. Administer thickened liquids. Rationale. Thickened liquids reduce the risk of aspiration in patients with swallowing difficulties, which is common in ALS. 69. A nurse is caring for a patient with meningitis. Which of the following isolation precautions should be implemented for this patient? A. Contact precautions. B. Airborne precautions. C. Droplet precautions. D. No isolation is needed. Answer: C. Droplet precautions. Rationale: meningitis, especially bacterial meningitis, is transmitted through respiratory droplets, requiring droplet precautions. 70. A patient is experiencing a seizure. What is the priority action the nurse should take? A. Administer oxygen. B. Monitor the patient's airway. C. Protect the patient from injury. D. Administer anti-seizure medication. Answer: C. Protect the patient from injury. Rationale: the primary concern during a seizure is protecting the patient from injury by ensuring the surrounding area is safe. 71. A patient with multiple sclerosis, MS, is experiencing worsening fatigue and weakness. Which of the following interventions is most appropriate to manage these symptoms? A. Encourage frequent rest periods. B. Increase physical activity to improve strength. C. Provide a high-protein diet. D. Restrict fluid intake to prevent swelling. Answer: A. Encourage frequent rest periods. Rationale: fatigue is a common symptom of MS, and encouraging frequent rest periods helps manage fatigue and conserve energy. 72. A patient with trigeminal neuralgia, TN, is experiencing severe facial pain. Which of the following medications would the nurse anticipate being prescribed? A. Carbamazepine. B. Lorazepam. C. Methylprednisolone. D. Dantrolene. Answer: A. Carbamazepine. Rationale: carbamazepine is commonly used to manage the pain associated with trigeminal neuralgia by reducing nerve firing. 73. A patient with a history of chronic migraines asks the nurse about preventive measures. Which of the following is a recommended approach for preventing migraines? A. Taking aspirin daily. B. Avoiding known triggers such as certain foods. C. Increasing caffeine intake. D. Practicing strict bed rest. Answer: B. Avoiding known triggers such as certain foods. Rationale: preventive strategies for migraines include identifying and avoiding triggers such as certain foods or stress. 74. A patient is recovering from a stroke and is now exhibiting difficulty with balance and coordination. What is the most likely neurological condition? A. Hemiplegia. B. Ataxia.
C. Aphasia.
D. Dysphagia. Answer: B. Ataxia. Rationale: ataxia is characterized by difficulty with balance and coordination, which is a common complication following a stroke. 75. A nurse is caring for a patient with a recent head injury. Which of the following is a late sign of increased intracranial pressure, ICP? A. Papilledema, swelling of the optic disc. B. Decreased heart rate. C. Increased blood pressure. D. Vomiting. Answer: A. Papilledema, swelling of the optic disc. Rationale: papilledema is a late sign of increased ICP, reflecting pressure on the optic nerve. 76. A nurse is assessing a patient who has suffered a stroke and has right-sided paralysis. The nurse knows that this is most likely due to damage in which hemisphere? A. Left hemisphere. B. Right hemisphere. C. Cerebellum.
D. Brainstem.
Answer: A. Left hemisphere. Rationale: right-sided paralysis typically indicates damage to the left hemisphere of the brain, which controls motor function on the right side of the body. 77. A patient with a seizure disorder is prescribed phenytoin. What is the most important nursing intervention when administering this medication? A. Monitor for signs of gingival hyperplasia. B. Assess the patient's blood pressure. C. Encourage the patient to avoid high-protein foods. D. Administer the medication at bedtime. Answer: A. Monitor for signs of gingival hyperplasia. Rationale: phenytoin is known to cause gingival hyperplasia, so it's important to monitor for this side effect. 78. A nurse is caring for a patient diagnosed with Huntington's disease. Which of the following symptoms is most commonly associated with this disease? A. Tremors and muscle rigidity. B. Uncontrolled movements and psychiatric symptoms. C. progressive memory loss. D. Sudden loss of sensation in the limbs. Answer: B. Uncontrolled movements and psychiatric symptoms. Rationale: Huntington's disease is characterized by motor disturbances such as uncontrolled movements, chorea, and psychiatric symptoms such as depression or mood swings. 79. A patient is diagnosed with a herniated disc at the L4, L5 level. Which of the following symptoms is most likely to occur as a result of this condition? A. Leg weakness and numbness. B. Upper back pain. C. Headaches and visual disturbances. D. Difficulty swallowing. Answer: A. Leg weakness and numbness. Rationale: A herniated disc at the L4, L5 level can compress nerves leading to leg weakness, numbness, or pain. 80. A nurse is caring for a patient who has recently undergone a craniotomy. Which of the following is the priority assessment for this patient? A. Monitoring for signs of increased intracranial pressure. B. Checking the surgical site for redness. C. Administering pain medications as prescribed. D. Assessing the patient's vital signs every 8 hours. Answer: A. Monitoring for signs of increased intracranial pressure. Rationale: After a craniotomy, it is critical to monitor for signs of increased ICP as this can lead to serious complications. 81. A patient with a history of stroke is being discharged. Which of the following should be included in the patient's discharge teaching plan? A. Smoking cessation and regular physical activity. B. Avoiding all forms of physical activity. C. Increasing salt intake in the diet. D. Restricting fluid intake to prevent swelling. Answer: A. Smoking cessation and regular physical activity. Rationale: Lifestyle modifications such as smoking cessation and regular physical activity are important for preventing further strokes. 82. A nurse is caring for a patient with a brain injury. The patient is exhibiting confusion and disorientation. Which of the following interventions should be implemented first? A. Assess the patient's airway. B. Administer pain medication. C. Initiate seizure precautions. D. Perform a Glasgow Coma Scale assessment. Answer: D. Perform a Glasgow Coma Scale assessment. Rationale: The first priority in assessing a patient with a brain injury is to perform a Glasgow Coma Scale assessment to evaluate the level of consciousness. 83. A patient with a history of chronic alcohol use presents with confusion and unsteady gait. Which of the following conditions should the nurse suspect? A. Alcoholic neuropathy. B. Brain tumor. C. Meningitis. D. Epilepsy. Answer: A. Alcoholic neuropathy. Rationale: Chronic alcohol use can lead to alcoholic neuropathy, which affects the peripheral nerves, causing symptoms like confusion and gait problems. 84. A nurse is caring for a patient with a seizure disorder. Which of the following is the priority action if a patient begins having a seizure? A. Administer a dose of lorazepam. B. Stay with the patient and protect from injury. C. Insert an oral airway to maintain airway. D. Restrain the patient's movements. Answer: B. Stay with the patient and protect from injury. Rationale: The priority during a seizure is to ensure safety by protecting the patient from injury. 85. A patient with Parkinson's disease is prescribed levodopa. Which of the following is an expected therapeutic effect of this medication? A. Increased muscle rigidity. B. Improved coordination and movement. C. Decreased salivation. D. Increased appetite. Answer: B. Improved coordination and movement. Rationale: Levodopa is used to improve motor symptoms such as coordination and movement in Parkinson's disease. 86. A nurse is assessing a patient with a cerebrovascular accident, CVA. Which of the following signs indicates a right-sided CVA? A. Left-sided paralysis and expressive aphasia. B. Right-sided paralysis and visual disturbances. C. Right-sided paralysis and memory loss. D. Left-sided paralysis and sensory loss. Answer: B. Right-sided paralysis and visual disturbances. Rationale: A right-sided CVA typically results in left-sided paralysis and sensory deficits, but visual disturbances can also occur. 87. A nurse is caring for a patient with a spinal cord injury at the T6 level. Which of the following complications is the patient most at risk for? A. Autonomic dysreflexia. B. Respiratory arrest. C. Impaired vision. D. Chronic hypotension. Answer: A. Autonomic dysreflexia. Rationale: patients with spinal cord injuries above T6 are at risk for autonomic dysreflexia, which can result in dangerous hypertension and other symptoms. 88. A patient with Huntington's disease is experiencing significant motor impairment. Which of the following interventions should be prioritized? A. Physical therapy to improve motor function. B. Strict bed rest to prevent fatigue. C. Administering high doses of sedatives. D. Providing high-calorie foods. Answer: A. Physical therapy to improve motor function. Rationale: physical therapy is crucial in managing motor impairments in Huntington's disease, improving coordination and function. 89. A nurse is caring for a patient with a suspected brain tumor. Which of the following symptoms should the nurse report immediately? A. Severe headache and vomiting. B. Mild dizziness and fatigue. C. Blurred vision and hearing loss. D. Occasional mild memory loss. Answer: A. Severe headache and vomiting. Rationale: severe headache and vomiting can indicate increased intracranial pressure, which requires immediate attention. 90. A nurse is caring for a patient with an ischemic stroke. Which of the following interventions should be implemented within the first 24 hours? A. Administer thrombolytic therapy. B. Increase fluid intake to prevent dehydration. C. Elevate the head of the bed to 45 degrees. D. Start anticoagulation therapy immediately. Answer: A. Administer thrombolytic therapy. Rationale: thrombolytic therapy is most effective when given within 3 to 4.5 hours of symptom onset for an ischemic stroke. 91. A nurse is educating a patient about the risk factors for stroke. Which of the following is the most significant modifiable risk factor for stroke? A. Family history of stroke. B. Hypertension. C. Age. D. Gender. Answer: B. Hypertension. Rationale: hypertension is the most significant modifiable risk factor for stroke. 92. A patient presents with the sudden onset of a severe headache, photophobia, and neck stiffness. The nurse suspects which of the following conditions? A. Meningitis. B. Glaucoma. C. Cluster headache. D. Sinusitis. Answer: A. Meningitis. Rationale: sudden onset of severe headache, photophobia, and neck stiffness is indicative of meningitis. 93. A patient is receiving treatment for a myotrophic lateral sclerosis, ALS. Which of the following findings is expected in a patient with ALS? A. Progressive muscle weakness and atrophy. B. Difficulty with short-term memory recall. C. Uncontrolled jerking movements, chorea. D. Sensory loss in the lower extremities. Answer: A. Progressive muscle weakness and atrophy. Rationale: ALS is characterized by progressive muscle weakness and atrophy due to degeneration of motor neurons. 94. A nurse is caring for a patient with a spinal cord injury at the C5 level. Which of the following interventions is a priority? A. Monitoring for signs of respiratory distress. B. Encouraging the patient to sit upright. C. Administering high doses of corticosteroids. D. Providing pain management. Answer: A. Monitoring for signs of respiratory distress. Rationale: a C5 level injury affects the diaphragm and can compromise respiratory function, making respiratory monitoring critical. 95. A patient with Parkinson's disease asks the nurse about the role of dopamine in their treatment. Which of the following should the nurse explain? A. Dopamine increases the brain's ability to think clearly. B. Dopamine is replaced by levodopa in treatment. C. Dopamine blocks abnormal brain activity. D. Dopamine causes involuntary movements. Answer: B. Dopamine is replaced by levodopa in treatment. Rationale: levodopa is used to replace the dopamine deficit in Parkinson's disease, helping to improve motor function. 96. A nurse is caring for a patient who has experienced a transient ischemic attack, TIA. Which of the following actions is most appropriate for the nurse to take during the first 24 hours after the TIA? A. Monitor neurological status and vital signs frequently. B. Encourage early ambulation to prevent blood clots. C. Initiate physical therapy for rehabilitation. D. Administer a thrombolytic agent. Answer: A. Monitor neurological status and vital signs frequently. Rationale: close monitoring for further neurological changes is essential in the first 24 hours after a TIA to detect any progression to a full stroke. 97. A nurse is assessing a patient who has been experiencing periods of confusion, agitation, and tremors. The nurse suspects delirium. Which of the following is the most likely cause of this condition? A. Alzheimer's disease. B. Acute infection or dehydration. C. Severe depression. D. Chronic hypertension. Answer: B. Acute infection or dehydration. Rationale: delirium is often caused by acute conditions such as infection or dehydration, which are common in hospitalized patients. 98. A nurse is caring for a patient with Guillain-Barré syndrome. Which of the following findings would the nurse expect in the early stages of the disease? A. Progressive ascending muscle weakness. B. Severe cognitive decline. C. Hyperactive reflexes. D. Sensory loss in the arms and legs. Answer: A. Progressive ascending muscle weakness. Rationale: Guillain-Barré syndrome typically presents with progressive ascending muscle weakness, often starting in the lower extremities. 99. A nurse is caring for a patient who has just been diagnosed with multiple sclerosis, MS. Which of the following should the nurse explain about the nature of the disease? A. MS is a progressive neurodegenerative disease that affects the motor neurons. B. MS is an autoimmune disease that affects the myelin sheath. C. MS is caused by viral infections that damage the nervous system. D. MS primarily affects the sensory pathways in the spinal cord. Answer: B. MS is an autoimmune disease that affects the myelin sheath. Rationale: multiple sclerosis is an autoimmune disorder in which the immune system attacks the myelin sheath, affecting nerve conduction. 100. A nurse is educating a patient with a spinal cord injury about autonomic dysreflexia. Which of the following should the nurse teach the patient to do if they experience symptoms of autonomic dysreflexia? A. Drink a large amount of water to flush out toxins. B. Sit upright and remove any restrictive clothing. C. Lie flat and apply cold compresses to the head. D. Take a sedative and rest in a dark room. Answer: B. Sit upright and remove any restrictive clothing. Rationale: the patient should sit upright and remove restrictive clothing to lower blood pressure during an episode of autonomic dysreflexia.